This article is from NBC News. Private health insurers use AI to approve or deny care. Soon Medicare will too. I found this to be a very interesting story that is going to affect a lot of people and probably make a lot of people upset, especially those who are on Medicare. So it starts out taking a page from the private insurance industry's playbook. The Trump administration will launch a program next year to find out how much money an artificial intelligence algorithm could save the federal government by denying care to Medicare patients. The pilot program, designed to weed out wasteful, low-value services, amounts to a federal expansion of an unpopular process called prior authorization. Those of you probably are familiar with this term. It requires patients or someone on their medical team to seek insurance approval before proceeding with certain procedures, tests, and prescriptions. So it's going to affect Medicare patients and the doctors and hospitals who care for them in Arizona, Ohio, Oklahoma, New Jersey, Texas, and Washington starting January 1st and run through 2031. This move has raised eyebrows among politicians and policy experts. Not a surprise. The traditional version of Medicare, which covers adults 65 and older and some people with disabilities, has mostly eschewed prior authorization. Still, it is widely used by private insurers, especially in the Medicare Advantage market. And the timing was surprising. The pilot was announced in late June, just days after the Trump administration unveiled a voluntary effort by private health insurers to revamp and reduce their own use of prior authorization, which causes care to be significantly delayed since Dr. Mehmet Oz, who happens to be on the Trump administration, he's the administrator of the Centers for Medicare and Medicaid Services. Quote, he says, it erodes public trust in the healthcare system, Oz told the media. It's something that we can't tolerate in this administration. But some critics, like Dr. Vinay Rathi, an Ohio State University doctor and policy researcher, has accused the Trump administration of sending mixed messages. On one hand, the federal government wants to borrow cost-cutting measures used by private insurance. On the other hand, it slaps them on the wrist. And that is confusing. Mehmet Oz is saying, well, we can't let them do that. It's going to significantly delay healthcare. But then at the same time, they're putting this system into place. It doesn't make sense. Administration officials are talking out both sides of their mouths, said Rep. Susan Delbanning, a Washington Democrat. It's hugely concerning. Patients, doctors, and other lawmakers have also been critical of what they see as delay or deny tactics, which can slow down or block access to care, causing irreparable harm or even death. Insurance companies have put it in their mantra that they will take patients' money and then do their damnedest to deny giving it to the people who deliver care, said Rep. Greg Murphy. He's a North Carolina Republican urologist. That goes on in every insurance company boardroom. Insurers have long argued that prior authorization reduces fraud and wasteful spending, as well as prevents potential harm. Just like before, this is to protect them, not us. Public displeasure with insurance denials dominated the news in December, when the shooting death of United Healthcare CEO led to many to anoint his alleged killer as a folk hero. And the public broadly dislikes the practice. Nearly 3/4 of respondents thought prior authorization was a major problem. In a July poll published by KFF, a health information nonprofit that includes KFF Health News. Indeed, Oz said during his June press conference that violence in the streets prompted the Trump administration to take on the issue of prior authorization reform in the private insurance industry. Still, the administration is expanding the use of prior authorization in Medicare. So how does that make sense? CMS spokesperson Alex Pons said both initiatives serve the same goal of protecting patients and Medicare dollars. So there's some unanswered questions regarding this. The pilot program called WISER, short for Wasteful and Inappropriate Service Reduction, will test the use of an AI algorithm in making prior authorization decisions for some Medicare services, including skin and tissue substitutes, electrical nerve stimulator implants, and knee arthroscopy. The federal government says such procedures are particularly vulnerable to fraud, waste, and abuse, and could be held in check by prior authorization. So I guess if that's the case, then depending on whether or not these procedures are life and death, if there are only certain ones that are vulnerable to fraud, then it kind of makes sense. So, once again, you have to get all of the details of the story before you can really make any determination on whether this is good or bad. Okay, so continuing on, other procedures may be added to the list, but services are an inpatient-only emergency would pose a substantial risk to patients if significantly delayed, of course. Inpatient only or emergency ones, if we're going to do that, that's obviously going to be a problem. I can't imagine them doing that. But they say it would not be subject to the AI model's assessment, according to the federal announcement. So that's a good thing. So while the use of AI in health insurance isn't new, Medicare has been slow to adopt the private sector tools. Medicare has historically used prior authorization in a limited way with contractors who aren't incentivized to deny services. But experts who have studied the plan believe the federal pilot could change that. Shared, let's see. So Dr. Rothi, he said the plan is not fully fleshed out and relies on messy and subjective measures. The model, he said, ultimately depends on contractors to assess their own results, a choice that makes the results potentially suspect. And it goes on to say that this is a pilot. So it's going to be a cumbersome process. I can almost guarantee you there are going to be delays, there are going to be denials, there are going to be a lot of people that are not going to be happy with this. And we'll just have to see. Once again, it's another industry, like I've said before, that's getting touched by AI, and even segments within certain industries. So you have the private medical insurance industry, and then now you have the government, which is the Medicare. And AI is involved in private. Now it's pushing over into the government-funded healthcare. So this is going to be interesting to see how this all plays out. But let me know what you think. What do you think about this? First of all, do you think AI should be involved in approval and denial of healthcare coverage? It's probably inevitable. But let me know what you think. Do you think this is a good thing? Do you think this is a bad thing? And do you think overall this is just inevitable? It's something that we cannot stop. Let me know what you think in the comment section, and we'll see you all in the next video. Thanks for watching.